I think I covered this, but my name is Ryan Morey, and I'm filling in for Rabia Taylor. I used to do this stuff for a long time, but like I said, I have a 3-year-old, and when he was born, I kind of just quit doing this because I just had too many things to do. So anyway, we're going to talk about Medicaid today, specifically long-term care Medicaid, because there's other kinds of Medicaid. Probably the biggest one that we get confused with is what they call MAGI, M-A-G-I Medicaid, and that's Medicaid for adjusted gross income. And basically what that is for lower income people, it will help them afford insurance, healthcare insurance. So that's not what we're talking about today. Today is just about nursing home stuff. Okay. So I think we'll start out with what costs are. So some estimates for in-home care, about $6,400 a month. And assisted living is running about $4,700 a month. And no, cost of care. So if you had somebody coming into your house to help take care of you, the average they're saying is about $6,300 a month.
What is it, 1,600?
I didn't say 1,600.
Oh, you just said 3,600.
No, I said 6,300.
Oh.
And then the assisted living, they're saying that average is about $4,700 a month in Colorado. And then the nursing home is about $8,600 a month. And we'll come back to that number, so give me a minute. So then the next thing I want to talk about is the difference between Medicare and Medicaid. I have given these presentations a lot of times, and at the end, people will ask me something about Medicare, Medicaid. So there is, as we were talking before, there really is no planning for Medicare, because for Medicare, you just have to turn 65 and you get Medicare. So Bill Gates gets Medicare. There's no asset limits or anything like that. You just got to show you're 65. So that's pretty easy. There's really no way to plan for that other than, trying not to die before you're 65, which is usually a good plan anyway. So that's what Medicare is. Medicare is health insurance. So just like Blue Cross, Blue Shield, any kind of like health insurance, it covers health events. So if you break your arm, it'll pay for, somebody to set your arm and the medication and the time you're in the hospital, pay for all of that. If you get dementia and you have to stay in a nursing home, it will not pay for that, because that's what we call a long-term care event. It's not actively getting better, and therefore a long-term care problem and not a healthcare problem. And that's also the same for any kind of health insurance. So TRICARE, like I said, Blue Cross, Blue Shield, whatever kind, Kaiser, all that is health insurance. And so it's going to help you and pay if you have some kind of thing that's bad but can be fixed. But as soon as you go to something that can't be fixed, then they're not going to pay you. Okay. All right, so after that, then we got, what are the non-financial requirements for getting on Medicaid? So first, you got to be a US citizen. Secondly, you have to be a Colorado citizen. If you're not a Colorado citizen, they would ask you to apply for Medicaid in whatever state you're a citizen of. And then you got to be 65 or older, or disabled or blind. And then finally, you'd have to have a medical evaluation. So any one of us here probably would not qualify for Medicaid, no matter what our financial situation was, because we probably don't need an assisted living. We can take care of ourselves. What the test is on what they call the ADLs, which is the activities of daily living. So the easy way to remember those is just things you do in the first hour. So you get out of bed yourself, you get a shower, you get dressed, you eat, take your medication. And then those are really the activities of daily living. So once you can't do 3 of those, then you could start looking at Medicaid. So like me, even if I never had $1, I would not qualify for Medicaid because I can do all that stuff. And also for my little kids, because I don't do anything. So, all right. So then we get into what most people want to know about Medicaid is, what are the financial requirements, right? So the first one we're going to talk about is the income. So the income limit's about $2,523 a month. But that's kind of like what I call the soft limit. And then the hard limit's $8,627. And so if you're over the 2,500, but under the 8,000, then there's just a Medicaid trust that they'll give you the form for, and you fill that out, open a bank account, and then you'll be fine. So I had a lot of people that make about $3,000 a month, and they're always like, I can never get on Medicaid, and it'll be fine. You just got to fill out a form and open a bank account. No big deal. So for most people, that's not a requirement. Now, if you're $1 over this $8,627, you can't get Medicaid. When I was doing this, I had one client, and all the time that I did it, that made too much money. He was a retired general. was pretty interesting because his wife was about 30 years younger than him. And she was like, we got to use all the income to take care of him. I was like, well, yeah. And she goes, well, how can I go shopping? And I said, well, you're married to the guy. He's got to be taken care of. I think that comes first, but apparently for her, not so much. So I don't know. It was interesting. All right. So that's kind of what we're talking about for the income. Most people are never going to have a problem there. That's not going to be the problem. And the physical stuff's not going to be a problem because people are not excited to go to nursing homes. So there's nobody with 2 hangnails that's like, I'd really like to go to this nursing home. So that's not where we get the problems. Mostly the problems are assets. So right now the limit is if you're single, you can have $2,000. If both spouses are applying for Medicaid, you can have $3,000. And then if you have just one spouse going on to Medicaid and the other one staying home, this is the CSRA, which is Community Spouse Resource Allowance. Now, what confuses people a lot is people talk about nursing homes as communities, right? Like you go there, they're like, this is a wonderful community. We have a pool. And like that's just how the terminology is used. But here, when they say community spouse, they mean the well spouse, the one that's in the general Colorado Springs community, not the one in the nursing. That makes sense. So if for the rest of the time, I'm just going to say the husband's the one that needs to go nursing home and the wife's at home, just to make the descriptions clear. So the husband can have $2,000 to go on Medicaid, and the wife can have $137,400. So what counts for that, or what does not count? Your primary home up to around $600,000 does not count against this $137,000. So if you have a $500,000 house, does not count against your $137,000. One car does not. Personal property, so like your clothing, furniture, that kind of stuff doesn't count. And if you have an irrevocable funeral plan, that also is not a countable asset against the $137,000. And you'd say, well, what does count against the $137,000? Basically everything else. So you got bank accounts, investments, IRAs, life insurance. If you have 2 cars, the second car would count. The good news with that is there's no specific order of the car. So you had one car worth $20,000, one car worth $2,000. You can make the $20,000 car not count and the $2,000 car count. So that's probably what most of our time is spent working on, is that kind of stuff. Okay. Any questions on that? Oh. Multiple vehicles, yeah. So that's where most of the planning comes in for Medicaid planning attorneys. So let's say the wife had $200,000, but you had a mortgage. If you just use that $60,000 to pay down the mortgage, that would immediately put you under the limit, and you could do something pretty easy. I have a lot of people will buy a new car with a warranty because they kind of know that once they go on Medicaid, they're only going to have this level of money, and they want to know that there's not going to be some big repair down the road. Kind of makes it feel better. So we do things like that. You can do prepay for your funeral plan because you kind of know that you're going to have to spend that money one way or the other. So we do that a lot. And then there's some super complicated ways that maybe we'll get into or not, but those are kind of the real simple ways that we can get into in like saving this. And then the other question that people have is, oh, can I give the money away? Or I've given something away. So in this example, somebody gave like their car away to their grandson because they weren't driving. That's a super common example where people are like, we haven't given anything away in a long time. And they said, do you have a car? And they say, no, I gave it to my grandson last week. Well, that's giving something away. And so what they do here is, so if we look over at this, it's real close to this. So this is what an insurance company, Genworth, what they figure the average cost of a nursing home in Colorado, $8,627. Colorado actually says they think the average is $8,609, which are pretty similar numbers. Like we're talking real close. So what Medicaid does is they say, hey, we're going to look back 5 years. And if you've made any gifts in the last 5 years, we're going to penalize you for making those gifts, because we think that instead of giving that money away, you should have used that money to spend on the nursing home instead of giving that money away and then asking us to pay for it. which actually kind of makes sense to me, right? So what they do is they say, we think the average cost of a nursing home is $8,609. We're going to divide the amount of gift that you made, and then that's going to give us a time period, in this case, 3.5 months, where you're not going to get Medicaid. And I think this is like underrated genius, right? Because let's say like this is the car, right? Gave it to the grandson. Grandson probably wrecked the car. Can't give it back. He can't sell it for $30,000. There's no way to get this money back. And so what Medicaid is doing is penalizing people for making this gift, but without having to get that money back, without having to determine exactly who it goes to, and just saying you can't have Medicaid for this period of time. So I've had clients where they took out like $30,000 in cash, and they're like, I don't know what happened to it. Well, Medicaid says it's a gift unless you can prove it's not a gift. And so in that case, they have no idea where this $30,000 in cash went. Was it given away? Was it not given away? But you can't prove anything, so they're going to say it's a gift. And in case, then they would say you can't have Medicaid for 3.5 months, but they don't have to go find that money. They don't have to try to reflow that car or whatever. It's much easier on Medicaid, right? So it's kind of a genius way to do it. Any questions on that?
There's long-term care insurance factor into, for example, the 5 year.
The 5-year look back would still count. So Medicaid could still look back 5 years for any gifts. But if you have long-term care insurance, the cool thing is, let's say you have like 2 years of long-term care insurance, just to give you an example. So the long-term care insurance is paying for 2 years. So this penalty period is not going to be that bad for you because you already got somebody else paying, right? So it gives you a lot more options, even if you don't have a full 5 years of insurance. So I think it's really good. Even if you have 1 year, it gives you so many more planning techniques. And statistically, you're not going to need more than a year anyway. The average time that people live in a nursing home, I believe, is like less than 2 months.
You might have been going, or at least where I went. That's the question. If I had long-term care insurance, does that go primary and first? And then I can't go for Medicaid till after I've exhausted LTC insurance.
Oh, that's a good question. You just wouldn't apply for Medicaid because Medicaid's going to say you can only go to these homes, you can only do this, you got to fill out all these forms. So as long as you had long-term care insurance that was paying, you probably wouldn't even mess with Medicaid at all. So if you had,
After that was exhausted.
right. Mm-hmm.
Say it again.
If you had long-term care insurance, you probably wouldn't mess with Medicaid until that long-term care insurance is exhausted. So if you had 2 years of coverage, you'd probably just be like, you know, I'm going to just pay for this. We can have whatever nursing home we want. We like this. This one's close to our house. I can go visit my wife, my husband easily. And if she or he makes it all the way through the 2 years of money, then we'll start thinking about Medicaid. There's also some things, if you made gifts, you could use the insurance to pay for that care of the time through the gift, the penalty period.
Does that gift, 5 year look back on the gift, is that, I presume that covers small amounts aggregated to the total amount during that 5 year period, or it does look for one lump sum?
No, it'd look for everything, but if you were, you know, taking your friend out for lunch every week, I don't think they're going to count that. I haven't had them get too technical. Like I said, I haven't done this in a few years. When I started probably 10 years ago, they would literally want every bank statement for 5 years, and it would go through every one. And then after a couple of years of that, they just didn't have enough manpower, and they would make you promise, tell me about any gifts. And then they figured if you didn't tell them and you got caught, that's federal fraud. So that's going to make you tell the truth. But they didn't go through every bank statement, which was kind of nice. I mean, I think on one of them, we spent $1,100 getting the bank statement because they didn't keep them. So you tell the bank's like, yeah, $20 per statement, and you got, oh, yeah. Okay, so this is how the penalty period works. I think it actually makes a lot of sense. And then these numbers change every year. So this number goes up every year. I think when I was doing it, I think 3 or 4 years ago, it was right around 7,000. To give you an idea, 4 years ago, it's gone up $1,600. And that can make a big difference. The divisor, let's say if you were giving like a house away or something, and it was, you know, 300,000, dividing it by 8,600 or, you know, 6,600, it's going to make a big difference on the end of it. So that number does make a big difference. And they change that every year. It's what Colorado Medicaid figures as the average cost of a nursing home per month. So, and we're pretty close to what Denver is, but sometimes you can do okay if you go to like a small town where it's going to be a little bit less money to be in a nursing home, and you're still dividing by that average number. It can kind of help you, because you might be able to go to Alamos or something and maybe get in a nursing home for $6,000 a month instead of $8,000 a month, but you're still dividing that gift by that $8,000 a month. So that's totally different. You have to have at least 1 day of service during wartime. And then if you have that and a few other things, then you can go to like the one in Florence. And then that's typically going to be all paid for, or a minimal, $1,000 to $2,000 a month. And they'll pay for everything else. That's that's like the VA benefits and the Medicaid are just like a completely different rule set. It's extremely difficult to plan for both at the same time, but
If you were, there's one self-profit affect the other.
a little bit, yeah, but they just have, like, if you have one or the other, that they're not going to say that you can't have the other one, but the rules are what requires you are so different that it's really hard to like, oh, okay, I'm going to do this and try to get both of them. It's like two different languages. It's so weird. Yeah. And the VA is just really a terrible organization to deal with.
I think it's interesting that you talk about how they're worried about gifts, which would be the easiest way to lose your cash.
Right.
But yet, in a case of a married couple where the husband went into the home, and they can see in your bank statement that you are taking a bunch of cash out of the IRA and you're buying a brand new car with it, which, as you described, makes perfect sense. Set up the wife, but they aren't going to question that unneeded Mercedes, but they're worried about cash value of a different car going to the ground.
Right. I think that's mostly because this is for you, like your money using for you or your spouse, and this is money going to somebody else. So I think that's just where they've done the rules. And these were done like in the 70s. So this is just kind of different.
I think one's just as obvious as the other.
Yeah, well, I didn't make them, so I was alive in the 70s, so I didn't do any of this stuff. Yeah.
I had a friend, and I'm really,
Okay.
and before he could go into a nursing home, he had to sell his house, and so he did. And he wasn't on Medicaid at that point. So that he only got $80,000 for the house. He was a hoarder. So that took so many months to use up, and it cost his Woodland Park $8,000 a month to be in that nursing home. Not a medic. He didn't yet tell him. So once that $80,000 was used up over 7 or 8 months, then they could apply for Medicaid.
Yep.
He's been there 5 years now, which is a lot longer
Wow.
than 1 year. So he's been.
Fine. I said
But
average. I mean, that's.
He has a lot of health problems, diabetes.
Yeah.
Little problems, but they're taking good care of him. But what I'm saying is, you had to get rid of your house and get that money spent down before you could qualify for.
Yeah. So if he was single, he could have the $2,000. Yeah.
But he didn't have any money. But the house was $80,000. You had to get rid of that.
Right. So 80,000 is more than 2,000, right? So that's what I said. Yeah. He could have technically kept the house.
But he didn't need the house. Couldn't take care of it.
Yeah. Yeah.
But anyway, the nursing home had that money on top and had it to their till before they would apply for him.
Right. Because he has to get down to $2,000 to be a Medicaid.
Oh, yeah,
Right?
down
So they call it
2,000.
spend down, right?
Spend down to 2,000.
Exactly.
But that's it, the bottom line for a single person, more than 2,000.
Nope.
in cash or in one of those accounts.
Right. You could have these things though. So he for sure should have bought a burial plan, because at
Well,
some
that
point
was
he's gonna
all-
die.
That was all part of it. Didn't go into the nursing home. As your burial plan.
Oh.
Taken care of it. Couldn't go on Medicaid for sure unless you had your burial thing. So we had done that ahead of time.
Good.
And spent it down out of that 80,000.
Yeah.
Paid $5,000 for the burial thing.
Good. Yeah. But he also could have bought a car. So like if you took care of him, like you could have driven around a nice car. You could do that a lot.
But I would have helped.
Yeah,
it would help.
right, exactly.
So anyway, I'm glad he survived 5 years. He's only 65.
Oh, wow.
So he's young.
Yeah.
But, with his diabetes, he was fainting all the time.
Mm,
It's been for defibrillator and, other things. But anyway, that was in 2017. So celebrated 5 years.
yeah, well, that's good.
I just turned 75 personally. Anyway, thank you.
Yeah, you're welcome. So any other questions on any of this? I think these are like the general rules for Medicaid.
Or when the time comes, what type of person will help you with this analysis?
There's a few Medicaid planning attorneys in town. There's a few private companies that do it. And so, yeah, I would recommend that you spend a little money because just the loopholes and somebody can look at you. So like one thing we didn't talk about is if you have a disabled child, you could have $1 million, give it to that disabled child in the kind of trust and go right on Medicaid. And so a lot of it's really example specific. So I think spending, and again, I don't do this. I don't make any money on this. So like, I'm not saying come to me because I don't do this, but I think a lot of that stuff, it's worth it for a few $100 to go. I need somebody to look over this to see, is there something where I can do where, you can really do it. So.
Or you don't very trustingly go right to wherever you go to.
Oh, to Medicaid? No. So I always describe that as like the IRS. Like you would never go to the IRS and be like, hey, I made $45,000 last year. How much do I owe? Right? They would be like, oh, 20%. You're like, wasn't there some deduction? Oh, no, don't worry about that. Right? Like, so it's the same thing. It would be like when you go to Medicaid, their job is not to help. Right? So they're not going to tell you that you could do this or you could do that. They're just not required to do that. The other thing I see is like when you're telling me like your friend sold his house, I've had them tell a lot of people, oh yeah, your house doesn't count, right? So you don't have any cash, you got an $80,000 house, you should just go right on Medicaid because you got zero money. House doesn't count against $2,000. You can go right on Medicaid, which is true. But what happens is then they take all of your income because, and then they take your income, give it to the nursing home, and then they pay whatever's left. Then that leaves you no money to upkeep this house. And so I've had this a bunch of times when people are like, what do we do? Like mom has no income anymore because it's all going to the nursing home and we got to have electric for the house. We got to have house insurance. And so what they'll do, what in my experience is like the kids will go take care of the house. The kids will spend $500, $600, $700 a month taking care of the house, going over every Saturday, mowing the lawn. And then mom will die. And then Medicaid will get the house anyway because of the estate recovery. I think that's the last thing that we didn't talk about. So if you're a single person and you die on long-term care Medicaid, they can put a lien on your property for the amount of money that they've spent on.
So the estate recovery program
Right?
is like if you are on.
Good. Just almost forgot. I was like, man, I need that.
Yep.
No, this is from the, oh, yes, Humana.
Yep.
If you're single, if you're married, so if it's like the husband again
Yes,
and he's
you
in the
are-
nursing
you're
home
not
and
the
they
only
spend
one.
$100,000.
Don't feel bad.
Our last one.
Because they figure if we took $100,000 from the wife,
funny, I
she
was
should be on
thinking
for sure on Medicaid.
Yeah.
And I was like,
Thank
oh,
you.
So
you're
they just
Brandon.
figure
Oh,
only on the
Brandon.
second spouse
I'm
or
glad
a
you
single
did because
person
I
they
didn't know
go
about it. I was like, wow.
usually just after the
Oh,
whole.
we're gonna do this every year.
Cool.
Clean next year, more
Then they don't
numbers.
go after
Right,
anything.
Corinne?
I've had them go like
I just had this
file on
epiphany
the
when I was
estate.
talking to Nick.
Uh-huh.
Every
You
vendor.
know, so if you do have to
Yes.
estate,
Well,
like
you're
I've had 'em.
creative, right?
I've tried
So
to
you can
negotiate with
design
them
You can either
Thank you.
design.
because they
a,
know that they get paid first.
Something.
So
text.
Okay.
like if you
Or
owed
your
money to a
document.
credit card and you owed money to
And we
Medicaid,
can
you get
send
it.
it out. to
Oh,
our
yeah.
sphere.
Oh, yeah. Definitely.
I've tried to
Definitely.
negotiate with them.
We might have to.
Yes,
Yeah, that might be too many minutes.
that's fine.
But no, I was thinking.
As long as they
that'd be a
confirm.
great way to
Yeah.
promote it next year.
Right?
Yeah.
Yeah.
But,
So they,
Just word of mouth.
Yep.
If I Medicaid settle the bill, well, I do that and argue with them.
right. That's nice that they wrote you a letter that said they weren't coming after you. That's
So
nice.
that was official letter from.
Yep. And I found them very reasonable to deal with. Like they'll give you a bill and everything, but I had one we were trying to clean out the house because it was kind of a hoarder situation, like you were saying, taking us months to clean out the house to sell it. And there was really no money other than the house. And every 2 months, the recovery would send me a letter saying, hey, we need to get paid. We're like, yep, give them a call back right away, say, we're working on it, we're trying to get the house clear. Like, as soon as we get money, we will pay you. And we did, but you know, they were nice, but they don't give up, so. Any other questions on Medicaid? I did a good job. Answered all your questions.
I asked if they're going down, down, down.
I know you had Zoom, didn't you? Can you help me for a little bit? So awesome. What's up, you guys? You have, es que sabes qué pasa, me hace
Not if your
falta mi
health is
gente.
good, no, because you have to, you
No,
need
yo
help
soy
with
del
different
Justice
things,
Center,
at least
acabo de
three of those
empezar.
activities of daily living, yep, ADLs.
Yeah, of course.
So we're doing drawings after this, right?
Yes, so I'm just setting up just so that I can go there.
Do you need help?
Receive.
No, she's gonna help me.
Okay.
Thank you, sorry.
Oh, that's Magi. That's
Mira
not
que
long-term care.
me mudé para Colorado Springs con mi esposo.
Magi, yeah.
Pues la última mudada
With
desde
your
Honduras.
health insurance, yeah.
Oh, wow.
Mhm.
Antes de
The
eso,
only way you can really get
estaba
Medicaid
en
at home, there's
California,
very
antes de
limited
eso
health
estaba en Nueva
care
York, antes
at
de eso estaba
home
en DC, antes de eso
for
estaba en
Medicaid, but you could do
Japón, antes de eso,
PACE.
o sea, literal,
And
soy,
PACE is paid through by
él
Medicaid,
es
and
militar,
then PACE can help you at home.
pero nos
So
retiró.
that's something else to think about.
Retirado,
Right,
yo no iba a estar en ese trote,
right,
pero
right.
último trabajo que tuve,
Yep, exactly.
mi Manuel,
Yep. Yep.
pero casi lo mismo.
Right.
Se quiere quedar.
Medicaid adjusted gross income, so it's MAGI. So it's just a program to help people with lower income afford health insurance.
Y ella estaba basada en Arizona.
And so they look at what your income is, and then it's like a sliding scale based, and then they'll, you still have to pay for your insurance, but usually it's much, much cheaper, right? Because it's super expensive on the open market.
Mañana le vale, ahí está. Y luego empiezo aquí en Justice Center.
Long-term care Medicaid's mostly,
O sea, la gente que tienen eso.
Yep.
Izquierda,
and then MAGI is a totally different thing.
medio buena que tenía.
Some states don't call that Medicaid, they call it something else.
Se
It's
fue de
just,
vuelta a California.
we in Colorado call it Medicaid because what happens is that the long story short, it's basically, it depends on what your income is. And Medicaid was really the government entity at that point was verifying income and assets all the time, because it's exactly what we're doing here. And then so Colorado said, oh, when we get this adjusted income thing for health insurance, we're just going to give it to Medicaid, because Medicaid has been doing figure out income and assets for a long time. So we just gave it to them. But other states have called it different things, and it's not part of their Medicaid. But it's like two totally different programs. I think most of them do, but there might be a couple of them, yeah. But Medicaid is a federal program implemented by each state. It's a little different in every state. I mean, it's mostly the same, a little different. So like as far as I know, California, these rules came out in 2006, I want to say, 2008, something like that. Deficit Reduction Act, I think it's 2006. Yeah, I think they changed the rules and it came into effect in 2008. But some of the states, like when I was doing this 3 or 4 years ago, California had still not adopted this. Whoops. So they had different rules. They had like the old set of rules that didn't adopt the new set of rules.
Yeah.
So you could do things in California like unlimited payback period. So you could say, you know, up for the last 15 years, my kid has mowed my lawn. And I think that's worth $100 a week. And you could pay the kid $100 a week for 15 years all at one time now for the last 15 years, right? To get rid of some money, where you can't do that here. So
I guess the key is activities of daily living. 5 of those activities, you said 3 of them are required. Qualify for Medicare.
you have to have help with 3, yeah.
The question is, you have to have help, or can you can do these, you know, you just said it, you have help to do, you need help to do 3 of those 5 ADLs.
Then you'd be considered physically eligible. Yep.
If you can do it without help, you're not eligible.
Yep. Right. So I was telling the last class I was doing one, and there's a Medicaid interviewer, and they come out, and I remember she asked my client, who has this, she's sitting at the table, she has her walker right next to her. She goes, "Do you use your walker?" The lady's like, "Nope, never ever use a walker." And the son is like, and I'm like, no, just calm down. And so she asked her again, "You ever never use a walker? I hate walker." I was like, okay. And then the lady said, "Okay, thank you. The interview's over." And the lady gets up, gets back in a walker, and walks out the door. And we're just like, I don't know why. It was just funny.
Oh, that is hilarious.
And we're just like, okay. And they said that, yeah, she needed help with her ADLs, but just straight up like, nope. Like, it's really obvious that you do, like, and that's fine, but it's just like, it's funny.
Oh,
People are
that's-
funny. She
yeah.
thought she was totally getting away with it too. I was like, no.
Figure if my wife is legally blind.
Yeah, okay, that would count then.
She could do all those ADLs without any assistance.
Right. I think she would probably still qualify physically then.
You know?
Mm-hmm. Yep. Well, thank you for coming. I'll give you a hand. No, that's okay. Well, thank you. Take care. Here, I'll grab these for you.